Good evening, everyone. My name is Anika Srinivasan, and I'm Project Officer of Mental Health Foundation Australia. We begin today's proceedings by acknowledging the traditional owners of the various lands on which we meet today. And I pay my respects to their elders, past, present, and emerging. And I also extend this respect to any Aboriginal or Torres Strait Islander people here with us in attendance. On behalf of Mental Health Foundation Australia and our chairperson, Mr. Vasan Srinivasan, I would like to welcome and thank each and every one of you for attending our launch here in the Australian Capital Territory for National Mental Health Month 2021. National Mental Health Month is an initiative of the Mental Health Foundation Australia to advocate for and raise awareness of Australian mental health as a community. The MHFA's National Mental Health Month is unlike many other mental health awareness campaigns. It aims to bring together all Australians in a nationwide conversation about mental health, and we aim to maintain this conversation for an entire month and beyond through a series of various mental health related events. National Mental Health Month is a program that the MHFA is extremely proud of, and we tend to reach out to and educate as many Australians as possible to help reduce stigma and facilitate positive and non-judgmental discussion surrounding the important topic of mental health in Australia. With 1 in 5 Australians experiencing a mental health illness, it is time we give mental health its due attention, and that is exactly what the MHFA is wanting to achieve. Throughout this month, many events have been organised in each state and territory of Australia, aiming to attract and unite Australians of all ages and backgrounds to raise awareness of the need for better mental health for all. This year, the theme of National Mental Health Month is Post-Pandemic Recovery Challenges and Resilience. This year's theme will focus on raising awareness about mental health in various industries and communities. Every individual has faced, and many are still facing, unprecedented challenges due to the COVID-19 pandemic. With this theme in mind, we aim to extend our campaign even wider than previous years, with events planned to embrace many different community groups and people of all ages walking on the road to recovery and fostering resilience. Please join us in celebrating the Mental Health Foundation Australia by viewing a short video.
Hi everyone, I'm Vasan Srinivasan, Chairperson of the Mental Health Foundation Australia. It's a privilege to lead this wonderful community-based mental health organisation in its 91st year of establishment. The MHFA has grown strength to strength over the past few years. With Victorian Mental Health Month in 2018, the National Mental Health Month occurring in 2019, 2020 and this year in 2021. Last year, COVID-19 did not stop us from achieving our National Mental Health Month campaign. I'm proud to say we successfully shifted many events to a virtual platform, very much being able to pursue our objectives of raising awareness and advocating for better Australian mental health. Our primary aim is to reach out to and educate as many Australians as possible, to help reduce stigma and to encourage constructive and non-judgmental dialogue on Australia's critical mental health issue. The highlight of last year's campaign was reaching out to 100,000 Australians all across the country for our National Walks for Mental Health, both virtually through our MHFA app and physically in some states. What a grand success that was. In 2021, with pandemic still affecting many of us, we decided not to give up once again, curating a carefully chosen blend of virtual and physical events for Australians to participate in. This year, we have a new and improved MHFA app, giving people the opportunity to participate in National Mental Health Month from the palms of their hands. This year, theme is Mental Health and Post-Pandemic Recovery Challenges and Resilience. Mental Health Foundation Australia is proud to partner with Australian technology business DB Results and take up the wellbeing app Am I OK? to support our members, enabling individuals to regularly check in on a private and secure platform and ask the question, Am I OK? Am I OK also alerts the user when it's time to seek outside help. We thank DB Results for this opportunity to promote well-being and early intervention. This year, we have launched a special initiative, the Mental Health Appeal on the 10th of October, our World Mental Health Day. Through this, we aim to raise funds for the development of a course promoting life and safety in young people. At the MHFA, we pride ourselves in making sure all our programs are for the community and powered by the community. We have a vast growing network of multicultural ambassadors, youth ambassadors, and future leaders who further the community voice in promoting mental health and well-being. Our multicultural network has inspired our educational and multicultural webinars as an initiative to assist individuals cope with success during the pandemic. I would like to take this moment to thank our board directors and patrons, scientific advisory committee members, our wonderful staff, multicultural and youth ambassadors, future leaders, MHFA members and major sponsors for their continuous support to our organization as we continue to work to deepen understanding of the importance of mental well-being and educating the community. Let's work in solidarity for the benefit of our mental health. Thank you, Australia.
Thank you, and good evening, everyone. My name is Varshini Vishwanath, and I'll be joining Annika as MC for tonight's event. Thanks, Annika, for starting us off and playing the video. I would now like to invite Mr. Jim Gooden, Vice Chairperson of the Mental Health Foundation Australia, to welcome you all. In 1987, Jim joined the Mental Health Foundation, and from then onwards, he has served and participated in many organizations and mental health roles, including as chairperson and vice chairperson of the Mental Health Foundation Australia, vice president of the Australian National Association for Mental Health, director of the Tourette Syndrome Association Victoria, and many more. Jim has also chaired and been a member of numerous advisory and organizing committees, including chairing the Mental Health Week in Victoria, now called the National Mental Health Month, since 1995. Jim currently chairs the Million Minds Advisory Committee operating out of Sydney University. The mission's goal is to help an extra 1 million people be part of new approaches to mental health prevention, detection, diagnosis, treatment, and recovery. Mental Health Foundation is playing a major role in this project. Please join me in welcoming Jim Gooden.
Good evening to you all. My name is Jim Gooden and I'm the Vice Chairperson of the Mental Health Foundation Australia. I would like to begin by paying my respects to the traditional owners of the lands on which we meet today. And I pay my respects to elders, past, present and emerging. I also extend the same respect to any Aboriginal or Torres Strait Islander people here with us today. I would like to welcome and thank everyone who has taken the time to join us today. This is a very special event where we launch our National Mental Health Month campaign for 2021 in the Australian Capital Territory. I would like to take this opportunity to welcome all our special guests who are here with us today. Minister Emma Davidson, Mr. Andrew Braddock, Associate Professor Petra Bauer-Gelt, Justin Muller, Mr. Kevin McCoy, Kieran Bowie, and our 2021 Mental Health Advocate of the Year, Purity Go. I would like to thank also Varshini Vishwanath for being our MC for tonight. Thank you to you all for accepting our invitation as we launch our exciting month ahead. As well as thanking you all for being here, I would also like to thank the Mental Health Community Coalition in the ACT for their work as the peak body in helping to make this event possible. Like this launch, there is a launch happening in every state and territory of Australia, whether that is virtually or physically. These last 2 years have been unlike anything any of us could have imagined, with COVID-19 bringing many new norms such as social distancing, work from home, quarantine, and so on. The Mental Health Foundation Australia has made sure the pandemic situation does not compromise our National Mental Health Month campaign. We have organised many virtual and physical events on many different aspects of mental health. This year, our theme for National Mental Health Month is post-pandemic recovery, challenges, and resilience. And what a relevant theme this is, considering the impact the pandemic has had and is continuing to have on all Australians. To facilitate the task of running all these different events in 2018, the Foundation implemented our Australian Multicultural Ambassadors and Australian Youth Ambassadors program, comprised of dedicated network of volunteers across the country, with the aim to reduce the stigma associated with mental health issues within culturally and linguistically diverse communities, and generally within the Australian community. With great pride, I say we have a network of over 300 ambassadors across the nation. I would like to say thank you to the ambassadors in the ACT for their continued support. I would also like to thank our patrons, board directors, scientific advisory committee, multicultural ambassadors, youth ambassadors, future leaders, volunteers, and all well-wishers of the Foundation for their contribution towards organising all the events within this year's National Mental Health Month Awareness campaign. Last but not least, I'm sure all our board of directors will agree with me, a huge round of applause to our staff member Anika Srinivasan for the wonderful work she has put in for this launch to come to fruition. I once again thank you all for joining us today. With your support, we can achieve many great things regarding the reduction of mental health issues and the stigma that shadows them. Thank you.
Thank you so much, Jim, for your support. I would now like to introduce the Honourable Emma Davidson MLA, who has kindly sent through a pre-recorded address. Minister Emma Davidson is a member of the ACT Greens, Minister for Disability, Minister for Justice Health, Minister for Mental Health, and Assistant Minister for Seniors, Veterans, Families, and Community Services. Please join me in viewing Minister Davidson's address.
Yorma, I acknowledge that I'm here today on the land of the traditional custodians of this region, the Ngunnawal people, and the neighbouring Ngambri and Narragaow people. This always was and always will be Aboriginal land, and as sovereignty was never ceded, I recognise that to become a truly reconciled nation, we must listen to, understand and support First Nations people. So I pay my respects to First Nations elders past and present and acknowledge them for their nurturing of future leaders, and I acknowledge any Aboriginal or Torres Strait Islander people who might be watching today. I'm really excited that we're all here today to talk about Mental Health Month. Apologies that I couldn't be here in person today, but I have a few words I would like to share. As Mental Health Minister in the ACT, Mental Health Month is something I'm really excited for. I want to acknowledge that this year in the ACT and in many other parts of Australia, we're celebrating Mental Health Month during a COVID-19 lockdown. This can be a difficult time for our mental health and wellbeing as we're separated from loved ones, co-workers and some of the important things we love to do, on top of what's already been a really stressful past couple of years since the Black Summer fires first started. I was really proud recently to announce funding for local service providers in the ACT to increase their capacity and ensure that all Canberrans can access the help no matter where they sit on the continuum of need. The recent ACT COVID-19 mental health support package provides $2.4 million to help people cope during and beyond this lockdown. We know that certain physical health conditions can be a social determinant to mental health. As part of this package, the ACT government announced an additional $1.44 million for community health organisations to address these conditions. I was also pleased to broker an additional $2.57 million from the Commonwealth Government for Canberrans to have even more access to mental health support. I'm grateful for Mental Health Month conversations and events to bring the community together, to understand what challenges we face when it comes to mental health and wellbeing, and also to build resilience in our community and help people stay safe, kind and healthy. National Mental Health Month is led by Mental Health Foundation Australia to advocate for and raise awareness of the importance of mental health. It's an opportunity for the Australian community to come together to raise awareness and promote better mental health for all. Each year, 1 in 5 Australians experience a mental health issue. This could be you, a loved one, a family member, a friend, a colleague, or a neighbour. It can be tricky to see this or know how to talk to people about how they or you are feeling and where to go for help. The great thing about Mental Health Month is we hear from many different organisations about all the amazing support and resources they offer, so we can add to our toolbox and be in a good position to help people in need. It's also a time to encourage us to extend a hand and ask our loved ones if there's anything else we can do to support their mental health. It might be the first conversation you have about supporting someone's mental health, but it shouldn't be the last. Regular conversations and interactions with our loved ones about their mental health will mean more people have access to support and more people can be safe and healthy. Mental Health Month should also be a time to stop and reflect on our own mental health, taking the time to understand that there's a lot going on between lockdown, working from home and homeschooling. It's okay to need more time to do things and appreciate that they may not be done as well as they would have pre-lockdown. Across the country, our capacity is stretching thin, and it's really important that we stay kind to ourselves and practice some self-compassion. The theme of National Mental Health Month 2021 is mental health, post-pandemic recovery challenges and resilience. It might be hard for some people to imagine a post-pandemic world at the moment, and I think that says a lot. This month is key to raise awareness about mental health, understand the unique challenges people have been facing, and identify how we can make sure their needs are met as we emerge into a better supported and more resourced post-pandemic world. Alongside National Mental Health Month, the ACT Health Directorate is proud to partner with the ACT's Mental Health Community Coalition to raise awareness about Mental Health Month locally. We encourage Canberrans to get involved in the range of ACT activities throughout October to bring communities together in a COVID-safe way, celebrate positive wellbeing and learn more about mental health services in the region. The 2021 theme for Mental Health Month ACT is Navigate Your Mental Health, and it's about how we can help one another using tools and resources such as self-care for wellbeing, communication about support needs, and connection to support persons and service providers. I'm so grateful and impressed by the amazing online resources we have that can help us when we need that extra bit of support or we're not feeling our usual best. Information about the range of events to promote mental health throughout October in the ACT will be published on the Mental Health Month ACT website and social media platforms. So I encourage you to get involved this Mental Health Month ACT this October, and to find out more, visit mentalhealthmonthact.org. It's so wonderful to see so many people coming together today to talk about mental health, wellbeing, and how to be compassionate to ourselves during lockdown. I look forward to what the rest of the month has in store. Thank you.
Thank you so much, Minister Davidson, and we appreciate your support this year and would like to send a token of our appreciation, which will be posted to you very shortly. We would now like to invite Mr. Peter Kane, MLA, Member for Ginninderra, Assistant Speaker, Assistant Shadow Attorney General, Assistant Shadow Treasurer, Shadow Minister for Planning and Land Management, Shadow Minister for Regulatory Services, and Shadow Minister for Jobs and Workplace Affairs. Raised in Hunter Valley in New South Wales, Peter Kane had a 20-year career as a high school mathematics teacher, then as a teacher and principal in the non-government school sector. He was later drawn to the legal profession and law degree in 2001, being admitted to the ACT Supreme Court role soon after. Prior to his election to the ACT Legislative Assembly in October 2020, Peter managed the tax dispute section within ACT Treasury and served as Vice President of ACT Law Society from September 2017 to September 2020. Peter was also chair of the Government Law Committee from 2014 to 2020. Peter and his wife, Claire, have 7 children and have lived in Evatt since 1997. Peter is focused on being an advocate for the people of Ginninderra to ensure they receive the infrastructure and services they deserve. Please join me in welcoming Mr. Peter Kane.
Thank you so much, Varshini. I'm just checking everyone can hear me.
Yeah.
Thank you so much. And good evening, and thank you for inviting me to the official launch of National Mental Health Month here in the ACT to hear more about what, among other things, discussions around mental health in the post-pandemic era will look like. And I really do applaud National Mental Health Month for their theme, post-pandemic recovery challenges and resilience, and also your hashtag resilience, and recovery, two very important ingredients in helping anyone on a mental health journey. I'd also like to acknowledge the Ngunnawal people and that we meet on their traditional lands, and acknowledge any Aboriginal or Torres Strait people in the audience or who hear this recording later. Thank you too to the Vice Chair of MHFA, Mr. Jim Gooden, for your official welcome. And I'd also like to acknowledge my fellow parliamentarians, Emma Davidson, MLA, from whom you've heard, and Andrew Braddock, MLA, from whom you'll soon hear. I do pass on apologies from our mental health Shadow Minister, Julia Jones, MLA, and I'm glad that a tripartisan approach attendance here tonight shows that mental health is not just a party political thing, but is a vital ingredient of sensible and sound governance, policy and decision making. As mentioned, I'm here on behalf of the Canberra Liberals and very glad that this event is being hosted. Hopefully next year we'll be able to meet in person for a similar gathering. The term mental health is bandied about a lot, especially during COVID. And unfortunately, as you would all be aware, it's not a term that many Australians are comfortable with, even if they had heard of services like Lifeline or Are You OK, Dave? But this is changing. It has changed in my lifetime, and this is a very significant achievement. And I do hope that the growth in mental health awareness, the normalisation of discussions about mental health. I do thank National Mental Health Month and other similar organisations for encouraging this change. Recently, concerns about mental health have consumed how we have faced lockdown. It was one of the key themes I heard at the first day of public hearings of the ACT Legislative Assembly's Select Committee on the COVID response in the ACT. I do acknowledge and welcome the additional funding that's come from the ACT government, but also would like to thank and recognise the federal government's additional $2.5 million to ensure Canberrans can access support during lockdown. This is very welcome news all round. And the need support, of course, doesn't just end with lockdown or the end of other restrictions, but support will need to continue and evaluation need to be made of the effectiveness of such support. And just as a bit of a side note, and this is not in my printed notes, this afternoon I spent a bit of time ringing my electorate through one of our suburb regions and to see how people are coping with the lockdown. And I had an interesting observation presented to me that providing mental health with more additional funds is really good, but how those funds are spent is very significant. And I was given the challenge of seeing how that money could be directed towards providing more mental health practitioners into the service and support mechanisms, either in government or in other organisations. So I do kind of see the need as a need, along with additional funding, of encouraging mental health practitioners and boosting the opportunities the community has to access their services. Look, I thank you again for having me this evening. I'm available. Both my shadow colleague Julia Jones and myself are easily available. We can be found if you need any assistance or would like to talk to us about the Canberra Liberals policies on mental health. I look forward to seeing you all hopefully in 12 months' time in person, and enjoy the rest of your evening. Thank you.
Thank you very much, Mr. Kane, for supporting this evening, and a token of our appreciation will be posted to you shortly. Now I would like to invite Mr. Andrew Braddock. Mr. Andrew Braddock, MLA, is a member for Yarrabee, elected in 2020. He is the ACT Greens spokesperson for better neighbourhoods, corrections, democracy, integrity and community engagement, multicultural affairs, police and emergency services, and workplace safety and industrial relations. Please join me in welcoming Mr. Braddock.
Thank you, Yashina, and thank you all for coming along today. You might have been seeing in the chat in terms of our great regret that we weren't able to congregate in person. I was particularly looking forward to the mental health ambassadors. We're planning to do a walk around Yarrabee Pond, which is a local lake we have in our district, and we've been surreptitiously planning one for 2 days after the lockdown lifts. So I would invite everyone to come and join us, mostly because getting out into the sunshine, into the fresh air, and undertaking physical exercise, as I'm sure everyone here knows, is one of the best things you can do for your mental health. And I encourage everyone during these times, make sure you're taking the time to do that. I do that on a very personal perspective as someone who suffers depression and has done so in the past. It is something that is an ongoing management challenge, and I would encourage everyone here, look after your mental health, particularly during such stressful times as these. We really need to be kind. And by that, I don't mean just kind to others and being understanding of where they may be coming from or what stresses and difficulties they might be tackling, but also kind to ourselves. Cut ourselves some slack, be kind to ourselves, understand that things are difficult right now, and that's okay to not be okay. So really encourage everyone to have those conversations with themselves, with their partners, with their friends and families and loved ones, with their work colleagues, so that we all connect. No one is going to be left behind in the mental health darkness. So I don't think I'll continue on much longer. You've heard the Emma Davidson as the Minister for Mental Health talking everything about what the government is doing. I just really want to push that message up for everyone to be kind. I don't think there could be anything better thing we can do during mental health. Thank you.
Thank you so much, Mr. Braddock, especially for sharing your personal experiences with mental health. We appreciate your continual support, and we will post our token of appreciation for you soon. I would now like to introduce Mr. Kevin McCoy, CEO of Independent and Assisted Living at Australia Unity, who has sent through a recorded address. Kevin McCoy was appointed CEO of Australian Unity's Independent and Assisted Living Division in July 2017, and has the great fortune to represent almost 60,000 customers across the company's Indigenous aged care, disability, and healthcare services. Kevin spends as much time as possible on the road for visiting Australia's Unity's customers and its 6,000 employees. He believes it's in his customers' homes, retirement communities, aged care homes, and the remote communities of the company's Indigenous customers that he gets to truly understand how to make a difference in the lives of those people who trust Australian Unity with their well-being. Through these travels, he has met some amazing people, heard some confronting stories, and seen the loneliness and laughed a lot. This experience has given Kevin an incredible insight into customers, older and vulnerable Australians, while also developing a respect, appreciation, and admiration for the healthcare workforce. In 2019, Kevin was a founding member of the Aged Care Workforce Industry Council and was acting chair until July 2021. He is also chair of Ramsay Connect, a joint venture with Ramsay Healthcare and a national provider of home and community-based healthcare and support. Please join me in viewing Mr. Kevin McCoy's video.
Good evening. I would like to start by acknowledging the traditional owners of the many lands on which we are meeting. I'm on the land of the Bunurong people of the Kulin Nation, and I pay my respects to their elders past and present. I also want to thank federal, state and local government representatives, community leaders and all attendees who have joined us today. Your presence demonstrates your commitment to mental health, and I appreciate you being with us. For those that don't know me, my name is Kevin McCoy. I am the Independent and Assisted Living CEO for Australian Unity. I'm really privileged to be representing two like-minded organisations steeped in a long history of working to improve the quality of life for the community. Across the month of October, a range of events have been organised to foster community, resilience as we navigate our way out of the COVID-19 pandemic. For 180 years, Australian Unity has supported Australians through times of war, financial upheaval and natural disaster, as well as in the recovery and rebuilding efforts that followed those shattering events. Today we face a once-in-a-lifetime pandemic, and our response remains the same. Good mental health is vital to our well-being, and at Australian Unity, well-being is at the heart of everything we do. 20 years ago, we conceptualized the idea of a national index of well-being that could be used to track social progress in Australia. The Australian Unity Wellbeing Index has been influential in shaping public policy and providing guidance for governments and other organisations on how they can contribute to improving individual and community well-being. 2 decades of research shows the secret of happiness boils down to 3 things that we call the golden triangle of happiness: good personal relationships, financial security, and a sense of purpose in life. We use the Wellbeing Index as a guide in everything we do, from the products and services we deliver to building real well-being for all Australians. Within our aged care operations, Australian Unity's home care services started developing comprehensive, goal-orientated wellbeing plans with its customers to be evaluated and revised at least annually to help them achieve their wellbeing goals. Around 70% of our customers in this area have been upgraded to wellbeing plans from their previous care plans. Over recent years, Australian Unity has been modernising its built form portfolio, with 5 of our current 7 aged care residential homes designed, built and operated to bring to life all 4 elements of our Better Together model. The Better Together model features a strong focus on health and well-being, modular small household footplates, and greater consistency of staff rostered to each household. The model is consistent with the Aged Care Royal Commission's recommendations that good design in residential aged care, particularly for people living with dementia, should involve smaller, lower density, congregate living arrangements rather than larger, more institutional settings. Our Remedy Healthcare business has provided its MindStep program to more than 2,500 folk. Built around low-intensity cognitive behavioural therapy, MindStep is a 6-week phone and internet-based program that empowers participants to manage their mental health on their own terms and in the privacy of their own home. More than 60% of MindStep participants recovered within 3 months, compared to a benchmark self-recovery rate over 3 months of 23% for untreated patients. Earlier this year, Remedy Healthcare, in conjunction with Australian Unity's Indigenous Services, launched a culturally sensitive adaptation of the MindStep mental health program called Healing Minds. The coaching program is tailored for Aboriginal people, developed by Aboriginal people, and delivered by Aboriginal coaches. Plans are underway to adapt the Healing Minds program for Australians from culturally and linguistically diverse backgrounds. This year, Remedy Healthcare also announced new mental health partnerships with Tasmania and Healthy North Coast Primary Health Networks to deliver early intervention for people at risk of mild mental illness. These government-funded services will support people with anxiety and depression, people experiencing isolation, those in rural and remote locations, and people affected by pandemic-related isolation and bushfires. Mental Health Month is an important opportunity to raise awareness about the impacts of mental ill health and the range of supports available that can improve our sense of well-being. Australian Unity is a company founded on social values and community contribution, and we are committed to building and promoting positive mental health strategies. We will continue to identify and help solve the health, care and wellbeing needs of the broader community. Thank you.
Thank you, Mr. Kevin McCoy and Australian Unity for your support, and a token of our appreciation will be posted to you shortly. We also have a video from Australian Unity about their MindStep
Good
program.
evening.
Please join me in viewing this video now.
The way I felt at the time was about everything was pointless. I wasn't enjoying art. I wasn't enjoying getting under the bonnet of the car. I wasn't enjoying people because I was about as low as you could go at that point. I was struggling for years, many years, for reasons other than Ben and Jackie's accident. After that accident that I referred to, a family tragedy where Ben was killed down in St Kilda, Jackie was injured from the waist down, there's no question that my mental health was in a parlous state. I wasn't participating in things. I was angry at the world. I got a cold call letter from Australian Unity, and it looked a little different to a lot of the other letters you normally get. It was a good letter. It had an offer of helping people to make them feel better. And I sort of felt a bit selfish that I was taking facilities and money and so on from an organisation. Did I deserve it? But that was pretty soon dispelled, that guilt. So I embraced this Mind Step program, and it just felt terrific to know that there was somebody else there apart from family, apart from friends, who was thinking about me, and I looked forward to the sessions we had. Mind Step worked because it came along, not only was it a great program, it came along at the right time. Setting those goals over time did make me have better habits, better way of coping with each day and getting through each day and enjoying each day. I feel so much more positive today than 2 years ago in the middle of that deep depression. The relationships with the family have improved astronomically. I can't tell you, I can only explain how I feel, and that is much better. The Mind Step program was tremendously significant in getting me there.
Thank you again to Australian Unity for that heartwarming and inspiring video about their Mind Step program. We now have for you the fantastic dancers from our official entertainment partner for National Mental Health Month, Bollywood Dance School Australia, to entertain us. Bollywood Dance School Australia is on a mission to share Indian culture with the Australian community through Indian performing arts and dance forms. They share the joy of dance to empower and motivate individuals to whilst enthralling performances through their performance. Please join me in viewing Bollywood Dance School Australia's performance.
I am what I say. घुंघटा उठा के मिला ले तू अखियां, कहने दे कहती है जो तेरी सखियां। अरे घुंघटा उठा के मिला ले तू अखियां, कहने दे कहती है जो तेरी सखियां। ये प्रीत है पुरानी, मैं राजा और तू रानी, हाँ तेरे मेरे जन्मों के वादे। राधे 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 ओ राधे राधे राधे, तेरे बिना कृष्णा तो लगे आधे आधे। राधे 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 ओ राधे राधे राधे, तेरे बिना कृष्णा तो लगे आधे आधे। राधे 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 ओ राधे राधे राधे, तेरे बिना कृष्णा तो लगे आधे आधे।
ये बोल दो आएंगे देर से, फिक्रे सब छोड़ दो। आज हक से अपने हिसाब में हम जो करने चले, गलती वो जोड़ लो। तो आज यार कुछ लम्हों के लिए बिगड़ी राहों पे तुम पैरों को मोड़ दो। आज हक से दुनिया को जितने हैं कायदे वो सारे तोड़ दो। हो खुले ग्राउंड में आके ऊंचा साउंड बजा के, रेड वाला कलर लगा के नाचेंगे हीरो बनकर। वो जय जय शिव शंकर, रंगूड़ है भयंकर, रंगूड़ रे दो, रंगूड़ रे दो। हम आए शंकर के मूड है भयंकर, रंगूड़ रे दो, रंगूड़ रे दो। वो जय जय शिव शंकर, बेबी तेरे लिए रखा पल्लू संभाले। Do you know, तू जो चाहे वो कर दूं मैं तेरे हवाले। उड़नी उड़े उड़े रे अखियां मुड़े मुड़े रे, उड़नी उड़े उड़े रे अखियां मुड़े मुड़े रे, मेरे सीने में कुछ और। केम छो मजामा के ओढ़नी ये ओढ़नी ओढ़ू ओढ़ू पर उड़ी
चांगली तुझा माझा प्रेम आहे फिलिंग आहे चांगली येरे येरे पावसा तुला देतो पैसा आला रे यो आला रे रोज वाजणार मुंबई तू चांगली तुझा माझा प्रेम आहे फिलिंग आहे चांगली येरे येरे पावसा तुला देतो पैसा आला रे यो आला रे और इसके बाद ये राजे जमा चमचल बेरों से बूंदे उड़ा अरे ढगाला लागली ढगाला लागली का
Thank you to our wonderful dancers from Bollywood Dance School Australia for that captivating performance. I would like now to introduce Associate Professor Petra Burgiel. Please feel free to correct my mispronunciation of your name if necessary. I would now like to introduce Professor to speak a few words. She is a transdisciplinary social scientist who lectures and researches at the University of Canberra. She is also a SILF Fellow, a research fellow at the Joint Centre for Disaster Research, and an international associate at the Centre for Applied Cross-Cultural Research. She is also the co-founder and former deputy chair of the Group of Energy Efficient Researchers Australia. For over 15 years, Associate Professor Burgiel has been investigating the interaction of psychological and environmental factors that influence risk reduction, preparedness, and responses for various natural calamities and pandemics in different countries, including Australia, the United States, and New Zealand. Associate Professor Burgiel has authored and co-authored over 70 books, chapters, peer-reviewed papers, state and federal government reports, and national and international conference presentations in the field of disaster preparedness and risk management, international migration, and collaboration. Please join me in welcoming her.
Thank you so much, Farshani, for introducing me, and good evening, everybody. It's an absolute pleasure and honor to be with you tonight. And to contribute to this really important work. I prepared a little bit of a PowerPoint presentation, which I would like to share with you. Just have to find it. Bear with me. Here we go. So I would like to suggest that a pandemic, or the pandemic we are currently in, could be a real important transformative opportunity for restoring health and rebuilding resilience. But before I start, I would like to acknowledge the traditional owners and custodians of country throughout Australia and their continuing connection to land and culture. And I pay my deepest respect to all elders past, present, and future for keeping and passing on their worldviews, knowledges, and practices, because as you will become to see, all of this knowledge is tremendously important. Now, I invite you to consider that the pandemic is one aspect of a century-long and growing existential crisis. Other elements of this existential crisis is increasing extreme natural events and disasters, climate change, environmental destruction, and loss of biodiversity, increasing food and water and security challenges, violence, wars, mental and physical disease. Fortunately, in the midst of every crisis lies great opportunity, as Albert Einstein already said. And this Chinese symbol for crisis suggests that in crisis, there is great danger, but there is also great opportunity. And as John F. Kennedy said, in a crisis, be aware of danger, but recognize the opportunity as well. So we could use this pandemic to stop and to reflect. How did we end up in this existential crisis? What's this opportunity? How can we turn the tide? So I invite you to consider that a crisis is an opportunity for individual and collective transformation. And by transformation, I mean experiencing deep structural shifts in our consciousness in thinking, feeling, and acting, which then create dramatically and permanently alters ways of being, seeing, and being in the world. But what needs transformation? And here I invite you to consider that the source of our existential crisis is that the majority of people in Western cultures living disconnected from and in disharmony with nature. This disconnect and disharmony has been developed in our Western culture gradually over millennia. And it is the consequence of Plato and Aristotle using reason to force our minds to separate from our psyche or soul, and Orthodox Christianity suppressing the wisdom of our pre-Socratic ancestors. And that created a Western worldview, which the Western worldview that emerged has, as a result, created a culture that promoted rationality and reductionism, and gradually colonized us by domesticating and conditioning us in ways of thinking and living that disconnected us from our ancestor, our ancient universal laws, our true natural primordial sacred divine nature, and the sacred invisible feminine spiritual realm. So in fact, the crisis we are experiencing is a cultural and spiritual crisis. So what's the antidote then? And there's increasing literature which suggests to move forward, we actually need to go back in time. We need to remember, cultivate, and living according to our sacred nature and the ancestral laws. And to expand our current rational, reductionistic physical worldview towards an extra-rational, holistic, nature-based metaphysical worldview. And this worldview is actually very akin to the Australian Indigenous worldview and to Indigenous worldviews around the world. So how can we accomplish this shift? We can engage in rational processes, and here we can critically examine, reflect, question, and revise our perceptions of ourselves and the world. And that would mean to decolonize and indigenize education, to engage in transformative education, nature-based and critical pedagogies. But also, and that's really important, to engage in extra-rational ways of knowledge, in symbolic, imaginative, emotional experiences, in creativity and imagination, and other processes outside of conscious awareness. And the major pathways here are interacting with nature, and that can be in many, many different forms. The importance really is to be in nature and engage deeply with nature. To engage with arts and humanities. And when I mean arts, I'm speaking about many different types of creative activities, singing, storytelling, dance, as you just saw, dancing uplifts, and other elements we can engage in also in humanities, and that means also writing as well. But really importantly, to also learn from Indigenous knowledges and sensitivities. And again, we can here in Australia, we are in the really fortunate position that we are having, that the traditional custodians are the longest living culture on Earth. So that's by engaging with Australian Indigenous peoples, we can return to our primordial nature. But also we can learn from our pre-Socratic ancestors in our Western culture as well. And by engaging in those processes, transformative processes, we can restore living connected and in harmony with nature, and that will restore resilience and our mental health. Thank you so much.
Thank you so much, Associate Professor Birgel, for sharing your insight and for your support. A token of our appreciation will be posted to you shortly. I would now like to introduce Mr. Kieran Bowies of The Chemist's Own, who has sent through a pre-recorded video. Please join me in viewing Mr. Bowies' video. I think we might be facing some technological issues, as we do in every Zoom event. We might move on to the next section and come back to the video. Each year, during National Mental Health Month, the Mental Health Foundation recognizes and celebrates the achievements and contributions of individuals, organizations, and groups actively working to remove the stigma and raise awareness of better mental health for all. This year in the ACT, a very special receipt has been awarded to the Mental Health Advocate of the Year. Purity is a highly motivated and professional person who moved to Australia from Kenya in 2007 to pursue tertiary education. She has in-depth work experiences across government and private sector organizations. She is passionate about mental health, especially as it pertains to people from diverse cultural and ethnic backgrounds. She is dedicated to increasing understanding of mental health issues in the hope of empowering her community. Purity is committed to volunteering, especially with regards to women's mental health, an initiative which she has been involved in for the past decade. I would now like to invite Purity to say a few words.
Thank you very much. Good afternoon, and thank you very much, Mental Health Foundation and Australia, and good evening all. I would also like to acknowledge the traditional custodians and owners of the land, the Ngunnawal and Ngambri people. I pay my respects to their elders, past, present, and emerging. I also pay my respects to elders of all cultures here today. I acknowledge all the distinguished guests, including the members of the Legislative Assembly, Mr. Peter Kane, Mr. Andrew Braddock, Ms. Joy Clay, Ms. Emma Davison, and all who are gathered in this virtual space, especially all my friends who have gathered to support me and my sister in Denmark. Thank you so much. I am deeply honored and grateful to have been chosen as the 2021 Mental Health Advocate of the Year for the ACT. I am still in shock and haven't really grasped this reality. My deepest gratitude to Mrs. Jackie Mbonzi and Dr. Bosibori Bet, who without their nomination and immense support, I wouldn't be here. When I landed in Brisbane in 2007 from Kenya, I didn't know what my future held, nor did I know much about mental health. But someone believed in me, and I was soon working in suicide prevention program for young people from refugee backgrounds. This was only the beginning. In 2011, I moved to Canberra, and after a brief period, I began working for the PIC organization, advocating for people with lived experience of mental illness here in the ACT. I worked there for 6 years and before joining the public service. Through my roles, I developed a deep understanding of how the mental health system worked and established strong networks. Armed with this knowledge and connections, I immersed myself in volunteering with the East African Community Association and also with an NGO called MELT, which stands for Moments of Experiencing Life Together. MELT was founded by Edith Muruka, an inspirational person and my mentor. Mental health literacy is central to my volunteer work. I know it makes a big difference if more people understand what signs to look out for and how to seek support from loved ones and/or primary healthcare providers. When you increase the level of understanding, you also reduce the level of stigma and discrimination regarding mental illness. In doing so, more people are empowered to take the necessary steps towards healing and recovery. This is what motivates me. I want to make a difference in our community by showing love, kindness, and compassion towards others. This award has humbled me and has caused me to further reflect on my journey here. I accept this award in the full knowledge that it is because of the many who have gone before me and paved the way that this is possible. So thank you very much once again, Mental Health Foundation. And thank you once again to everybody who gathered here and prides themselves in making a difference in terms of for people with a mental illness. Thank you very much. I'm so honored.
Thank you again, Purity, and congratulations. A very well-deserved recognition. Your award will be posted to you very shortly. I would now like to invite Justine Mueller, a fellow ACT Multicultural Ambassador, to share her personal lived experience. Justine is a community advocate with a Bachelor of Social Work, Master's in International Development, and over 10 years of professional work experience in empowering vulnerable communities, including refugees, homeless people, women at risk, and elderly community members across Europe, Asia, Africa, and Australia. Justine migrated from France to Australia in 2018 and now works in the domestic violence space. She experienced mental health challenges at the early stages of her settlement journey in Australia, which prompted her to get involved in the mental health space with the Mental Health Foundation Australia. Justine strongly believes in intersectionality and is committed to raising awareness of mental health issues. Please join me in welcoming Justine.
Can you hear me okay? Great. Good evening, everyone, and thank you for having me. My name is Justine, and I'm here to tell you about my journey in becoming a multicultural ambassador for Mental Health Foundation Australia. So I'm originally from France, and I came to Australia in 2018. Shortly after that, I was diagnosed with depression, anxiety, and PTSD as a result of domestic violence. So I wanted to share with you a little bit of my journey in accessing mental health support. I very often heard, oh, well, Justine, you are from a Western country, so it's the same as Australia. Well, this is not entirely true. To give you a bit of an example, on my first week here, I wanted to see a GP. And when I entered in what I thought was a medical practice, I told the employee that I had an appointment with a GP. And the employer responded, well, you are in a bank. So something as simple as finding a medical practice suddenly became not that simple. In my country, it's also very common to see a psychiatrist because it's covered by Medicare or the equivalent. So here I will tell my doctor to see a psychiatrist, and they will be very confused, and I will be very confused about their confusion. So when I finally managed to understand that I needed to go to have a mental health care plan, it took me more than 4 attempts to find someone I could finally connect with, someone who was not stereotyping me, someone who was culturally sensitive, and someone who was not so culturally biased. For example, I was working full-time in a financial institution, and yet I was told by a psychologist to take English classes. Thank you very much. I felt really alone in this experience. I felt like I was fighting against so many things at the same time. And I wish I would have been able to share my experience with someone else, with someone going through the same thing. Starting a treatment was not an easy step. And especially I think it's even true when we are away from our home country, our friends and support group. Overall, I think you can understand that my experience was not particularly, my experience in accessing mental health support was not particularly amazing. And I think when there is an overlap of challenges, it makes the access even more complicated. And I think this is particularly the case for multicultural communities. when I felt like I really needed support, I had to adapt so much to therapists. I had to explain my culture. I had to explain my language. And I think this is why I immediately felt so enthusiastic about Mental Health Foundation Australia. I think you can pick what you want. You can pick what will benefit you. And this is very, very empowering. You can learn and grow in a safe way. You can access the support group that you believe you will benefit from. And I really wish I would have known this organization earlier, to be honest. Now, for me, being a multicultural ambassador is about raising awareness about mental health, but also linking community members to practical support, a practical support that is culturally appropriate and relevant to people's needs. And I know that with Mental Health Foundation Australia, individuals are in good hands. And I know that here they can create meaningful connections, they can heal and grow safely. So thank you for that.
Thank you so much, Justine, for sharing your personal experiences with us tonight. Your journey is truly inspirational. Our token of our appreciation will be posted to you shortly. Before we conclude tonight's launch event, we would like to play 2 short videos on our mental health appeal and our walk for mental health. Please join me in viewing these videos.
Over 400 young people lose their lives to suicide each year. This number is 400 too many. This year, the MHFA is launching the Mental Health Appeal on the 10th of October, raising funds to develop an evidence-based training program primarily aimed at promoting life and safety in young people. Join us this October in the fight against suicide. Your dollars and cents will help us prevent. Visit our website for more information on how you can support this cause. We're counting on you, Australia. Australia, are you ready for a challenge, and that too for a good cause? Then look no further. Join the MHFA as we walk for mental health across the country on the 17th of October at 10:30 a.m. in each state and territory capital. Worried about COVID? Well, we've got you covered. We have launched our MHFA app where you can walk virtually, raising funds as an individual or in a team. Visit our website for more information about getting started. So come on, Australia, our journey to better mental health starts with one step.
Finally, thank you all for being here tonight at the official launch of our National Mental Health Month 2021 here in the ACT. We appreciate your support and look forward to a bigger and better National Mental Health Month in 2022 as well. Thank you and have a great night ahead, possibly with some self-care included to embrace the spirit of this month. Thank you so much. Have a lovely night.